Bismillahirrahmanirrahim. Assalamu alaikum everyone. I am here from Conceptual Medicos, and today we will talk about pharmacology, the sources for pharmacology and how to study pharmacology. So regarding pharmacology, it has always been a method. It is a very difficult subject, and some students can't get higher marks in pharmacology because of the stress that it is a difficult subject, but it is not much. First of all, the book selections are very important for pharmacology. So for that purpose, I have divided the students of Pakistan into three groups: the KMU, Khyber Medical University students, non-KMU Pakistani students, and USMLE aspirants. So first of all, coming to the KMU students. So for KMU students, as I have gone through many of the papers of our of KMU pharmacology papers of the KMU, then mostly come from these books. Okay, the KMU student should keep this Tara book, that is an India book, a very simpler book, and everyone can read it without any difficulty. They should keep this as a textbook. Okay. Beside this, they should keep Kaplan pharmacology. Kaplan pharmacology notes are very helpful, as we can find Tara a bit deficient in certain topics, so that deficiency will be fulfilled by Kaplan pharmacology notes. You can mark the important high yield points from Kaplan pharmacology, and you can put them in the Tara in the respected topics. Okay. When you study each chapter in the Tara pharmacology with Kaplan pharmacology, then after going to the next chapter, first you should keep the Scherzen review and should solve the MCQs. They have 10 MCQs at the end of each chapter. When you solve these MCQs, then you will have a good command over the topics. They have MCQs and they have also the explanation for those MCQs. They will clear your concepts up to the high extent, and they are very high yield MCQs. If a student wants to study more and can't be satisfied by the Thara book, then he should keep Lippincott as a reference, but not as a textbook. Thara is a very good book for KMU students as a text. Okay. If a student wants to go a quick review over the topics at the exam night, he should open the Kerzing, and at the end of every chapter there is a table and which is specified and which is high yield, and you can get lot of information in less time. Okay, now coming towards the non-KMU Pakistani student, so they have a bit different pattern from the KMU student, so they should keep long Kerzing as their textbook. It is a bit long, but they should keep there and they should also keep the short Kerzing for solving the MCQs. Okay. As far as the long Kerzing is concerned, it consists of almost 1300 pages, so it is very difficult to revise this book. So gradually the student should come towards the short Kerzing and the BRS. The BRS is very high yield. It is an internationally recommended book. Every student should have a BRS pharmacology book, and at the end of each unit there are MCQs, and every student should do these MCQs. For USMLE aspirants, they shouldn't go for the long books. They should read the Kaplan medical pharmacology notes, and they should also watch the Kaplan lectures by Dr. Harris. We have 2014 lectures of Dr. Harris, the long lectures of classroom anywhere of the Kaplan medical. After watching these lectures, students should go through the Kaplan Pharma and notes. They should have BRS review, as I have mentioned earlier, and as many practice questions as they can. So I have told about how to study pharma, but I will summarize here that first go through the long book, then go through the reference book, and then at the end of each chapter go through the Kerzin MCQs, and at the end of each unit go through the BRS MCQs. And pharmacology can be learned very effectively when you teach it to your friends. Otherwise, it is a very volatile subject and can be forgotten in a very less time. Thank you so much.